Welcome back to Healthwise with our special guest, Dr. Elliott. Dr. Elliott, welcome back.
Thank you.
We were talking about affordability, and also before we get into the affordability, you had mentioned about the entry points, like which areas can you actually do liposuction? I mean, I know you just can't go to the whole body and just go everywhere, you know. There's certain areas that...
That's a good question, Reggie. That's the beauty of this new technology. We're able to do a lot of different areas that initially we couldn't do. We now can do the chin. Some people will call that the turkey neck or the double chin.
Right.
We can do the jowls, the chin jawline, make that more pronounced, more prominent. We do the abdomen.
Okay.
We do that lead, that put, you know, the little lower belly
fat. They call it the beer belly or
beer belly,
or whatever,
the pooch,
yeah.
you know. For most people who've had, for most women too, that may have had surgeries or C-sections, and they said, you know, I can't seem to get rid of this little pooch. I've worked out and done all these other things. We do the arms, we do the legs, we do the saddlebags. Saddlebags is that layer of fat along your hip line. We do the sides, the back.
Oh, okay.
There's this term that's not medical, but people call them the muffin top or the love handles. And I'm sure the viewers may know some of those terms.
Sure, that's it.
But yeah, we can do a lot of the areas, and we can. The great thing about this procedure again is we can remove fat in very small areas because the cannula is so small. We can reach areas that initially we couldn't do because the cannulas were really large, and we couldn't sculpt the area or contour the area like we did, like we can now.
So our viewers, I think when you say cannula, a lot of people don't, I know because I'm in the medical field and, you know, we use these, but what he's talking about is a little tube that the laser goes through. It's just a very little, you know, some people know about a nasal cannula. That's what they wear, you know, to receive oxygen in their noses and stuff. But you're talking about a little tube.
You're absolutely right. This is a very narrow, very small instrument that looks almost like a needle, but it has a blunt edge, which is actually interesting me, and hence the reason you don't feel any sharp poking or anything like that. It's actually a rather blunt edge. But it's actually about 1 millimeter in diameter, maybe, and that's very,
which is
very,
very
small. So it makes it quite comfortable for the patient.
Right. So being that you have that, I guess there's not a lot of scarring. See, that's something that I know a lot of our viewers would worry about is the scarring. You know, I mean, so being that it's that small, and it's just a very small, minute hole or opening that y'all use in the skin, I guess it's not a lot of scarring.
You're absolutely right. Just like I mentioned before, there's no incisions, actually. We're not cutting anything. What we do is we make these little pinhole entrance points. So at the end of the procedure, when you recover, there's really no major scarring, except, say, for just these little pinhole points that heal up and seal over very well. We leave these little pinholes to drain, and they heal up themselves. It's no bigger than maybe a mosquito bite.
Wow.
They're really small.
That's very, very small.
Really small.
That's very, and then a lot of guys I know, you know, would ask, is it okay for men to have that? Is this something that women get, or is it something that guys and, you know?
You will be surprised how many guys have this procedure done. This is all the craze. You'll be surprised. I was blown away. We've done a lot of the guys' jawlines. We've sculpted the abdomen. We've done, there's a condition called gynecomastia. Let me explain what that is. It's a condition where you get sort of an excessive breast tissue in males.
Okay.
Okay? In the past, that had to be surgically removed. Now, there's an indication. We can use this technology to reduce the fat in that area, and we've done that before. We've done, of course, a lot of guys are worried about their sides too, and their back and their thighs, just like the women do. I promise you, this is not just procedure for women. Men get this done all the time.
Well, when you get this done, does it come back? What's the deal?
I'm glad you asked that. When you talk about fat cells, okay, you have a limited amount of fat cells, okay? And there's a certain amount of fat that you can safely remove. But yes, once you disrupt the fat cells, you don't make new fat cells past a certain age, okay? So the cells don't necessarily come back. However, we can also not remove all the fat in your body. Understand that? There's some safe amount of fat that you also have to have in that's healthy for you.
Right, to continue to be. Yeah, I was laughing because my fiance, she kind of putting a little messages to me on the teleprompter to ask about banana rolls and don't forget about different things. So that's why I'm laughing. But you know, like I said, I think this is something that a lot of our viewers, you know, might be interested in, and I think would be interested in, as far as, you know, because being from South Louisiana, you know, we all suffer from this eating too much fatty foods and ends up building up, you know, in all the wrong places on us. So, you know, it's just interesting that now we have someone, and, you know, we talked about affordability. I saw where they said the Victoria's Secret model had the smart lipo, you know, and of course I know her smart lipo was probably, you know, she probably paid a pretty penny for it, you know, way more than we could afford. But let's talk about affordability, you know.
Again, it's so much more affordable than what these procedures used to cost back then, which were tens of thousands of dollars. Understand again that we had to have a lot of resources. We had to have anesthesiologists. You had to have general anesthesia. You had to have nurses in the recovery unit when whilst you come in, sort of recovering and that sort of thing. But again, this is a minor, relatively in-office minor procedure. It's done in a clean environment and a somewhat semi-sterile environment. So even though it's not done in an operating room, we still try to follow the guidelines as to having it in a clean environment. But still, it's nowhere compared to the cost that we used to have back then. So what we ask patients to do is come in for a consultation, and what they realize is that for a few $1,000s, they can get this procedure done just like all the celebrities do. And they look just as fabulous. In fact, we've got tons of people that want to look great for the spring break or want to look great for the reunion. Yeah. And again, summer is just around the corner, believe it or not. So, you know, it's time to go to the beach. So this is the time to get it done. That way you have all the recovery time, you know, the time to get the skin tightening effect from the procedure, which we didn't talk about, by the way. But it's much more affordable now.
Okay. Well, like I said, docs, thanks for that information. And we will come back to you for some more questions about that, especially about the skin tightening. And I think we were talking about Vaser and versus laser for larger amounts or larger fat deposits.
Absolutely.
So after we get back from this message, we will come back to you.
We'll be happy to.